From which hospitals would be used for intensive care patients to how they'd use PPE and clean. As cases climbed, masks became required, and hospital visits from loved ones were limited.
And I would say as a healthcare worker, that was one of the hardest things to do originally. However, when you understood the impact that it had to patients and families and the level of protecting them to keep them safe, it made perfect sense. I'll never forget, one of our very own became one of our intensive care patients. And he was incredibly sick, intubated, all of the things, and the fear that that brings when you are people taking care of our own was very real.
iPads and technology offer a critical connection in tough moments. An ER doc's therapy dog offered comfort that lingers today.
Dr. Ryan still has Peppy in the ER, and then our CEO, Casey, also got a therapy dog, and so Ralphie now lives at Rose Medical Center.
5 years later, COVID has gone from pandemic to endemic. Vaccines and new strains helping make cases far less severe for many here in Colorado and around the world. But Karen and Casey say Colorado's healthcare system feels the effects today.
If you were to say what's changed, I would say everything.
Yeah, I think we learned a lot from COVID. I think we learned how to better protect ourselves when a patient comes in with an infectious disease. I think we learned how to utilize our resources a bit differently and support our people.
Healthcare has changed and it has impacted everything. It has made us better. It has made us stronger.
We're still seeing waves of infections today. So far this year, COVID-19 has been listed as the cause of death for more than 5,000 people in the U.S. For some, the virus is not much different than dealing with a cold or a flu. But for others, it can completely upend their lives. Tracy Henson met with a patient in St. Louis and her doctor, learning about what life has been like for people with long COVID.
I worked 30 years. I was as a school bus driver. That's gone. Who retired at the age of 52?
Tanya tested positive for COVID in April 2021.
Feeling tired, very tired, exhausting. I couldn't put things together. Coughing, joints hurting. I mean, it was just bad.
By December 2021, her symptoms had not gone away, and she found herself with Dr. Chang at Washington University's Living Well Center.
So right now we think that there are more people living with long COVID than realize it.
People like Tanya living with symptoms like trouble focusing, chronic fatigue, uncomfortable breathing, bloating, nausea, and dizziness.
Long COVID doesn't have a specific blood test, and we can't check one blood work and say, yes, you definitely have long COVID. It's a little bit of a detective game.
Getting diagnosed with long COVID is only one part of the challenge. After that, it's a matter of weekly appointments and a dedication to feeling better.
When I got into the long COVID clinic, going through physical therapy, speech therapy, occupational therapy, they got me through.
Getting people through it, that's the goal of the Living Well Center.
Although we don't have a cure, we can help patients maximize their quality of life.
Businesses and schools shut down for months in 2020 as the country responded to the growing number of infections. And today, some remnants of that are still being felt. Reporter Ashley Grahams from our station in Portland, Oregon, picks it up from here.
Now at 11, the first case of coronavirus in Oregon.
5 years ago,
KGW's Mike Benner's in the newsroom tracking these
marks Oregon's first reported case of COVID-19.
Because chances are this will get worse before it gets better.
And it did get worse. Hundreds of thousands died across the nation, and businesses and schools were forced to shut down.
Now those lockdowns are over, and stickers like this asking people to stand 6 feet apart are wearing away.
Phil Geffner, the owner of Escape from New York Pizza, says while they took precautions, they never stopped selling pies.
No, we've been open the whole time. We just didn't let a lot of people in, and we kept the doors open, we kept the ventilation going.
Now, like many others, Phil and his restaurant of 40 years are moving forward.
Onto a new chapter now.
Only about 1 in 6 say it continues to be a major threat to public health. At the height of the pandemic, that figure was closer to 7 in 10.
A new Pew Research Center report surveyed over 9,000 U.S. adults. Over half said COVID is no longer something we really need to worry about, though the impact of the pandemic still affects us. Nearly 3/4 of those surveyed say the pandemic did more to drive the country apart than bring it together. And when it comes to the classroom, students across the country are still trying to recover, especially those in Oregon.
Our numbers are not where they need to be. The fact that our reading and writing numbers are so low, and in some cases, worse than pre-pandemic, unacceptable.
We'll have